organization. There are so many wonderful people represented here today, and it's just an honor to be with you. As Dean of the School of Public and Health Sciences, we are now at the second Western Massachusetts Health Equity Summit, and I see many of the same faces and many new faces from 2 years ago. You know that health equity, population health, and well-being is a real national dialogue, and it's a dialogue that needs to be had by many stakeholders, and those individuals are in this room today. Today we have individuals committed to improving the quality of people's lives, improving equity in population health and well-being. That includes community organizers, state government health workers, private health workers, politicians, community representatives, faculty, students, staff, university. That just is a few of people, those who must work together. You know, the school is also proud to coordinate and sponsor this event for the region, for the Western Massachusetts region, establishing a center for equity and health and population health and well-being. And we really hope that many of those in this room will contribute to that center, to improving both research, education, outreach, and workforce development in an area to which faculty and students are really committed, and so are many other people, those in this room, outside in the community, and it goes on and on. Well, I'm very excited that this day has arrived. If you remember the first ever Western Mass Health Equity Summit in 2014, 2 years ago, well, we didn't have one last year, but I will say that there was a continuation of that effort, but it was in the form of a health equity network, and many of you were involved in that network. And one important event of that network was the legislative breakfast on the county health rankings, which Representative Vega is nodding his head because he was quite an important contributor to that. I attended as well. And it focused on political leaders and access to and use of data. Data, advocacy, and policy or political impact, that is really what's going to make a difference. Coming together in those three areas can affect positive change. And that change can be done on regional and state level, because sometimes the national level is a little slow to catch up. But that doesn't mean we need to be held back. So let's have Massachusetts set the bar, which it already does in certain areas, about making positive change. But we need more positive change, and especially really in this area. I want to thank Shannon for recognizing a lot of the people who are associated with this event, the steering committee, the sponsors, in particular Bay State Health and the UMass Amherst Office of Research and Engagement. But I also want to send out a special thank you to Risa Silverman, who coordinates the School of Public Health and Health Sciences office. Yeah. I know I can't. Her title is too long. I can't spit it out before the applause starts. I'm going to have to shorten that. As the coordinator, the director of the school's Office of Public Health Practice and Outreach, she really does a terrific job. And the fact that this room is full at this time in the morning is wonderful, and a testament to not only the steering committee, the sponsor, but also her individual efforts. One last thing, I just want to mention that in addition to research and education, the School of Public Health and Health Sciences is really committed to educational opportunities and workforce development, as is Risa. It's one, obviously, from her office, that is a key focus. And so students from AIC, from STCC, Mount Holyoke, Smith, Hampshire, and UMass Amherst are participating in the summit today. We provide transportation. We try to make it easy for people to get here and participate. And I know it's a little early in the morning for those students in general, but if you could please stand and be recognized, because you are the future of the workforce. Thank you so much. And finally, I really want to thank all of you for participating in this truly collaborative effort between many stakeholders. It's just a wonderful example of how if people in the community work together, you really can make improvements. And in this case, we're really focusing on health equity, on equity in population health and well-being. So thinking to the future, I think this summit can get bigger and better every year or every other year, as it may be. And really, we want your thoughtful feedback about how to do that. We need everybody's input so that we are not working in areas that are not going to have the biggest impact for this region in the state. Now I'm going to ask our Provost, Katherine Newman, to come forward. She has supported the School of Public Health and Health Sciences, including its efforts to establish a Center for Research on Equity and Population Health and Well-Being. Her own research is in the area of equity, and she is a wonderful scholar and a better speaker than I ever will be. I want to let you know that she participated in the first ever Western Massachusetts Health Equity Summit, literally just a few months after she had arrived on campus, and I'm just so thrilled to have her join us for the second Health Equity Summit. Provost Newman.
Thank you so much, Dean Aelion, and welcome to all of you here to UMass. It's really wonderful to see this assembly this morning. It's hard to think of a time when your work could possibly be more important. We don't need to rerun what's happened to the country in the last 10 days or so, but I think we can all acknowledge that redoubling our efforts around questions of equity, access, fairness, social justice has never been more important. We are going to be facing crises, we already are, of legitimacy in our government, of support for the programs, both nonprofit programs and public programs that are so vital to the communities you serve. And this will only be counteracted by the vigorous, loud voices of people like those in this room who stand for principles and values, who stand for the people that they serve, who stand for the region we live in and the needs that it faces, because so many of our community members have been dealt a difficult hand with respect to unemployment, with respect to problems in our schools, drug-related issues, the list goes on and on. I was very privileged for about 8 years to serve on the MacArthur Foundation research group on socioeconomic inequality and health. And the one thing I learned from this long 8-year period was that while health care makes a very big difference once you're sick, and certainly can be helpful in prevention, the sources of inequality lie upstream from health care. They lie in forms of economic discrimination and inequality. They lie in duration of unemployment. They lie in all of the stresses associated with being below the poverty line or even just above it. And it is all of these social issues and economic inequalities that we face as a society, which have been galloping forward, sadly, in the last several decades, that we must be mindful of if we are really going to see any progress in health equity. That was the lesson I learned from my colleagues in public health who served on that committee, that fundamentally health is the end point, not the beginning point of the inequities that you are here to address. So I can't think of a more important time or a more important group of people to gather around, redouble your efforts, redouble your commitments. And if I could encourage you to do one thing, it would be as loud as possible about the things you believe in, now and for the next 4 years at least, because we are going to have to play a very loud defensive game in order to protect the gains that you've made and try not to shield those that we care about from what I am sure is going to be a very trying time. So welcome to the University of Massachusetts, which stands for these principles. I want to also acknowledge the extraordinary importance of our School of Public Health and Health Sciences, which is at the vanguard of these issues. The students, the faculty, the staff who work there, let's give them a round of applause. I hope you have a wonderful day. I wish I was going to spend it with you instead of spending it in my office shuffling paper, but that's what provosts do. So, welcome and good luck today.